So first up, we have Tony Sullivan, who's the co-chair of Keep Our NHS Public, also a member of the Save Lewisham Hospital local campaign and a retired NHS paediatrician. Launched the People's COVID Inquiry in February, and it's had 2 sessions so far, and you'll be able to catch those on YouTube. But over to you, Tony.
Thank you. Thank you very much for inviting me to speak. I'm going to talk fairly quickly in the 5 minutes. I hope that's okay. I want to talk about government actions over the last 10 years and government plans for the immediate future, and also then what our own response should be to and what Keep Our NHS Public stands for. The government has left our NHS and social care completely unprepared for this pandemic. Over the last 10 years, they've underfunded the NHS by over £30 billion a year now. They've cut 17,000 hospital beds. They've left 100,000 NHS staff vacancies. They've decimated our public health systems. They ignored their own pandemic planning. And now they're trying to grab the narrative by claiming the vaccine success as their own. But what is the true facts? The latest figure is 143,000 deaths have COVID on their death certificate. 38,000 have been care home residents, and 6 out of 10 of all deaths have been disabled people. The rate of death in this country, 189 per 100,000 of the population, compares to less than 0.1 per 100,000 in Vietnam. Only 35 people have died in the entire pandemic in New Zealand. And in a country half the population of Britain, Australia, less than 1,000 people. The government has let NHS and care staff down. They've let frontline key workers down. They've shown real contempt for public sector workers, and there's real danger of low morale. Privatisation has been their twin strategy with underfunding. 26% of NHS funding now goes to independent sector contracts. If you exclude GPs, it's 18% of the NHS budget. But increasingly, primary care, that's GPs, are in danger of corporate takeovers. Notably, Centene, the US corporation, has recently taken over 50 GP practices in Britain, and they also have contracts for system planning in the NHS and data contracts. So, and the proof of direction of travel of the government is the £37 billion they've given to often friends and political cronies of failed PPE contracts during this pandemic. The government now plans to centralise control of the NHS by merging clinical commissioning groups. Those are the area fund holders. And from the 1st of April, there'll be 42 huge CCGs. For example, South East London, 1 CCG for 1.9 million people. And they are imposing integrated care systems as a new structure. Currently, no legislation, but there's a white paper now on the cards. And we have to know what the dangers are in that white paper a little bit more later. But they are going to legalise cronyism. They are purporting to be ending or reducing privatisation, but in fact, they're making privatisation large scale and less easy to oppose. So our response, Keep Our NHS Public believes that access to healthcare is a human right. We believe that the NHS as a publicly funded, publicly provided and accountable service is the service that delivers the most democratic health to the population. It should be free at the point of use and available according to need. That is no longer the case for 600,000 undocumented people. We need to be highlighting the dangers of the white paper. It allows contracting to continue, but without scrutiny or guidance that is needed. We see the dangers of that already with the Centene takeover, and that could be accelerated. There's a democratic deficit with reduced public accountability. We must demand that meetings are held in public, that papers are held in public, that local authority and the public still have the right to challenge proposals to reorganise our health service. And we must challenge, finally, the counter-narrative that the government has saved the population in this pandemic. The People's COVID Inquiry is set up for that purpose. And as you kindly introduced, we've had 2 sessions now. They have truly been fantastic in their analysis of what has happened. And there's 6 more sessions going through to June every fortnight. Please do link up with that, and I'll give you the links for that shortly. We are opposing racism in Keeper NHS Public in the context of defending migrants' right to healthcare, to access healthcare and to counter the fear of the hostile environment. And the other things that we're campaigning on in my last few moments, we're campaigning against trade agreements with other organisations like Global Justice Now. We're opposing the GP takeover by Centene. We're opposing the integrated care systems and white paper, and we are working with other organisations, including disabled activists, to demand a national care support and independent living service. So I hope that's a little flavour of what Keep Our NHS Public is about. Thank you.
Thank you so much. And I'm sorry that it's short contributions from everyone, but it is because we want to include so many different voices in this campaign. Our next speaker I'm very pleased to introduce is Hector Wesley from BARAC. Hector is a trade union activist as well as a long-term campaigner in terms of anti-racism, and in, well, he can speak for himself, but they've run amazing campaigns in BARAC around pushing back racism and the Tories agenda. Off you go. Hector, are you? I'm wondering if, have you frozen, Hector? Are you there?
Okay, thanks very much for the introduction. And very glad to be invited to speak again at a zero COVID event. I was on a few topics because, as I said, I've got limited time. If you haven't already seen, I would commend David Harewood's documentary on BBC One at the beginning of the month about why COVID is killing people of colour. Certainly provoked a lot of debate, certainly amongst some of my work colleagues. I think one of the things, the good thing that the documentary did do is it did sort of indicate and give examples of some of the existing health inequalities that affect Black, Asian, and minority ethnic people within this society. So as I do recommend people watch that if they haven't already. I mean, clearly, I'm certainly, in my organisation, BARAC, fully support an elimination strategy. The idea that we would have to live with sort of low levels of COVID indefinitely, I don't think it's acceptable prospect. Because what that will mean is people dying. And we've got to be absolutely honest and straight about that. So clearly, I think we do need to continue to campaign for an elimination strategy. Elimination strategy is certainly possible. It's definitely not impossible. I know I've had lots of arguments with people that think it is impossible, that, these things, you can't get rid of it completely. I think we absolutely do need to challenge that particular narrative. And I think we also, as a previous speaker has mentioned, we've got to challenge the government's mishandling of the pandemic, because clearly, if you look at the polling evidence, it seems that a government is getting quite a lot of the credit, it seems, for the vaccine rollout, but appear not to be getting some of the blame for some of the mishandling of this pandemic. And I think people might have heard in the last few days the Public Accounts Committee report on the government's test and trace. I refuse to use the term NHS test and trace because largely it was run by consultants that were brought in by mates of senior officials in government. And one of the key findings of that Public Accounts Committee report is that there was no clear evidence that the programme had reduced the level of infection. Now, given the amount of money that has been spent, £22 billion in this particular financial year, that's, I think, is an extraordinary finding. And when you put that in the context of the controversy regarding what has been offered to NHS staff, to 1% pay rise that the government proposed to offer to NHS workers, £22 billion could work out at a £14,000 bonus for every single NHS worker. So again, and last point I mentioned on this, when it comes to something that when a former permanent secretary in HM Treasury calls Test and Trace the most wasteful and inept spending program of all time. That gives you an indication of some of the mishandling that has taken place in terms of this pandemic. One of the terms that I've learned about the last few weeks is a term called the COVID triangle. I've never heard of it for the last few weeks. And I've heard, if you heard about this COVID triangle, the COVID triangle is a term that's used in London, particularly to refer to 3 London boroughs, Redbridge, Newham, and Barking and Dagenham. And those 3 neighbouring boroughs, adjacent boroughs, have been most badly impacted by the COVID-19 pandemic. And the commonality that goes through them is significant levels of deprivation, but also, a very ethnically diverse population. And I think one of the key things, again, that COVID has done, it has absolutely shone a light on inequalities in this society. And it's brought to the fore issues that many
Hector, 1 minute, but I think we may have lost Hector. Okay, I can't see Hector. I think we've lost him. So I'm hoping that I won't be speaking over Hector when he reconnects. But meanwhile, let's move to Ellen Clifford, if you're there, Ellen. Ellen is an amazing activist that I'm pleased we have joining us today. She's the author of The War on Disabled People, Capitalism, Welfare, and the Making of a Human Catastrophe. I think I can't recommend that book highly enough. And she's also a member of DPAC, the Disabled People Against the Cuts National Steering Group. Ellen, welcome.
Thanks, Elaine. I bring solidarity from DPAC. It's so great to be here today with so many allies. Many disabled people are still shielding, still in fear for their lives, fully aware that not only are they more at risk of catching COVID, but also if they do fall ill, that treatment is far from guaranteed due to treatment rationing guidelines that deprioritise disabled people. As Tony mentioned, 59.5% of COVID-related deaths from January to November last year were of disabled people, and that's probably a minimum figure given the lack of proper data. The mainstream discourse on those disproportionate disabled people's mortality rates portrays the situation as somehow understandable, focusing on the fact that disabled people with underlying health conditions, are more susceptible to the virus in the first place. When statistics were published showing that younger adults with learning difficulties were up to 30 times more likely to die from COVID than peers of their non-disabled peers of the same age, Public Health England explained this in the media as down to the fact that people with learning difficulties have higher than average incidences of obesity and diabetes, and also because people with learning difficulties might struggle to understand social distancing rules. So in other words, people with learning difficulties were effectively blamed for their own deaths on the grounds that they're fat and stupid. There was conspicuously no mention of the numerous social factors and political decisions that directly led to their deaths, to the fact that people with learning difficulties are more likely to live in group homes due to the paucity of suitable community living support after 10 years of cuts, to the problems ensuring adequate PPE in group homes not helped by privatisation of the social care sector, and to the number of unlawful do not resuscitate orders that have been put on medical records of autistic people and people with learning difficulties during the pandemic. Disabled campaigners often feel that society doesn't care about us, and it's difficult to think otherwise when debates have raged around us for the past year, giving air to arguments that our lives are dispensable, that they can be sacrificed for the economy. And it's true that dominant attitudes in society place a lesser value on the lives of disabled people. But there are so many people who do care, like those of you here today. Disability is part and parcel of working class life, given that disability and poverty are intrinsically related. Where disabled people's voices are absent are among those in positions of power and influence. But now through lockdown, with the very real threat of the virus still raging around us, disabled people are being kept behind closed doors. The reality of their lives is hidden away effectively. segregated away from our communities and with our own homes. And that's why the government calculates that they can get away with measures such as refusing to extend the £20 universal credit uplift to those on legacy benefits. There are 2.2 million people still on legacy benefits who haven't moved over to universal credit, and 3/4 of those are disabled people. And they've been denied that extra £20 per week through the budget that the Millionaire Chancellor passed last week. Disabled people's costs have gone sharply up through shielding, leaving them even less able to afford the necessities of life than they were before the pandemic, such as bathing, doing laundry, heating their homes and eating properly. Before the budget, DPAC collected testimonies from disabled people in that situation and carers as well. And they were truly awful stories that were sent through. We tried to deliver a bag of 190 letters to the Treasury, but those were sent away on grounds of security. But the Tories don't care about disabled people. In fact, they want those on benefits to live as desperately and miserably as possible, to serve as a warning to all those who can work, to ensure they take up whatever shitty, barely paid, grueling jobs that are going to be on offer as the economy opens up again. So we need to come together to actively demand a decent living for all, to defy attempts to control and silence us, and to give hope to all those who are living isolated and frightened at the moment, to give hope that there is a future. Together we can, but divided we will fall. Solidarity.
Thank you. Thank you so much, Ellen. Our next speaker will be Clare Rayner, who is from Long COVID. Clare has survived COVID twice and is a retired occupational physician. And we're really glad to have you having survived and with us today, Clare.
Thank you very much indeed. I'm really glad to be able to come and speak again with the Zero COVID organisation. Can you hear me okay? Yeah, thank you. So yes, I developed COVID in March last year, so a year ago. Everybody was coming into work with coughs, colds, sore throats, and probably all of that was COVID. I'm actually in the shielding group, so I understand what it's like to be particularly vulnerable clinically. And in my case, it's to be vulnerable to infections. So I always was. It took me a long time, 9 months, to mainly recover from the first episode. And then Christmas having been cancelled within our family, I nipped outside to get a few bits of food shopping. And that's probably where I contracted it the second time. Luckily, it wasn't so long to get better that time, but a year on and I'm only just about there. Again, in my case, it led to lots of bacterial infections. I'm saying this because it gives an example about one of the consequences of catching the infection, which is long COVID. I was previously an occupational health physician before I retired on ill health, and I seem to have been brought back out of retirement to help with efforts in the workplace and trying to make things safer there. But one of the key things that I've got into since I've been ill is to get together with other people who've had COVID and who were experiencing these very prolonged symptoms. And we've been very vocal in trying to get doctors to believe patients, hospital doctors to understand some of the consequences of the infection. And I'm on various committees as a patient representative or a community representative. So that includes the NHS England Task Force on Long COVID clinics, and also sitting on a committee that's allied to the World Health Organization to try and get treatments to everybody. So I think my message to people is, it's not just those who end up in hospital. This disease hits so many people and they've struggled at home. And I think it's these prolonged symptoms which are so difficult. As an occupational physician, I'm very interested in work and workplaces. So I'm very concerned about people not being able to go back to work, because they've been off sick for a year or many months. I'm very concerned about the people who have lost their jobs early on, and I'm sure that a lot has been said about this and the jobs that will be available to them. So I think when we're thinking about zero COVID, it's preventing people getting the infections in the first place, because there are these hidden consequences, which is long COVID. I'm just looking at my notes so I don't forget things about what I want to say. I think for me, a big concern is the economic consequences of people having long COVID or and losing their work. I think there are a lot of people who are off sick. I think this is going to have a massive impact. I'm also helping the Society of Occupational Medicine, trying to work with workplaces to assist people back to work, because I think people can do some things if they want to. And with COVID, after the infection, we find that it does require a careful return to work. Employers need to be flexible. They need to be flexible because the condition lasts for a long time and because people are struggling to function. So they need to have longer phased return to work. And I've written a leaflet for workers on return to work after COVID. If you haven't seen it, I will give you the link. And that's perhaps the thing that I am most proud of in all the speaking out that I've done, because I wanted it to be something for everybody, something that could give them a little bit of confidence when talking to the employer, and some suggestions about what employers could do to help people back in.
1 minute.
That. Well, thank you. In regards to workplaces, I think it's extremely important to look at all the controls that could be put in place. So the so-called hierarchy of controls. Vaccinations will help, and the fewer infections we can get, the better, but we've got to look at ventilation and safe working practices and not crowding people together. And I think we also have to look at how people travel to work, if they have to travel to work. I think the last two things I want to say is that I am interested in good work, in inverted commas. I think we're going to have to pull together as community and try to make good work for everybody and help each other in smaller communities to work, give each other work. And yes, a mention about the inequities. As I've said, it's those that may have lost their jobs already, or those that don't get sick pay, who don't get pay when they're isolating, and I think they should be helped. I hope things that I've said have been of some use, but I'm right with you.
They have, of course. Thank you so much. We are slightly behind time. I do have a mute button. I'm not afraid to use it, speakers. But our next two speakers, and in the middle of that, I hope we're going to have some more pictures and little video clips. But our next two speakers are people who are taking action, industrial action around the issues of the employers making us pay for the crisis and safety at work. So I would really like to welcome Pat Gleave, who's the Unite Branch Secretary at Queen's Road Bus Garage, who are resisting a disgusting situation where bus drivers, who are some of the most at-risk people in terms of their work, are facing pay cuts and including sick pay cuts. So over to you, Pat. Welcome.
Hi. Yeah, I won't get involved with all the other problems that the dispute's causing, you know, regarding the fatigue and everything else for the conditions. I'll try and stick to COVID. At the end of the day, we've been fighting with Go Northwest for a while before the dispute regarding the COVID. They don't seem to understand COVID, I don't think, because I had to take them to the health authority just so they'd get enough hand cleaning stations and everything else. So we've got a bit of a level, but they don't do testing yet. But what I want to talk about really is the fact that we're in dispute at the moment and the company's bringing buses and drivers from all around the country, Wales, everywhere, all mixing the different strains of COVID in our area, which I don't really understand. I don't understand how they can do that. But we're running buses at the moment with, I mean, we've got it quite strict now on our buses, where we have screens, we have doors, and we have all the holes in the screens covered up. But we're running buses now with no doors, no screen. Some of the drivers don't even have masks on these buses. People are only like a foot or two away from them when they're paying the fares. They're paying £1 fare. They don't have machines, you know, so they're just taking cash. You know, I mean, it baffles me when we've fought for ages to get the company to put in strict measures, and all of a sudden, because they want to bring in these buses to beat the strike, that they can run all kinds of buses, you know, with all kinds of relaxed social distancing. The seats aren't marked so that you only can sit in certain seats, so you have social distancing. It's just baffling. I just can't understand how they can get away with it with the authorities. But that's all I want to say really regarding the dispute.
Thank you, Patrick. And I hope it will be possible to put into the discussion document and the chat how we can send messages of solidarity and donations to you. Our next speaker is someone I'm proud to introduce as a member of my own trade union, the UCU. She's the branch secretary of Birmingham City UCU, who have been exhausting themselves organising against unnecessary face-to-face teaching and are now have balloted for strike action and are preparing industrial action. So Rhiannon, extremely welcome to have you with us. Pleased to have you.
Thanks, Elaine. Solidarity, a big thank you to all of you for inviting Birmingham City University UCU to this event. Less than a week on from International Women's Day, I want to remember Sarah Everard, who was killed this week with a police officer charged currently with her murder, Breonna Taylor, killed 1 year ago today by US police, and the children and teachers of Dunblane killed 25 years ago today, along with all the tens of thousands of people in the UK and millions worldwide who've lost their lives to COVID. I believe all of these people have died as a result of the same thing, which is the patriarchal, racist violence of our capitalist system, a system which seeks to control and police our movements and our work, whether this is deciding whose lives are expendable in the pursuit of the economy over humanity under COVID, whether it's controlling access to the food, healthcare and homes that we need, or whether it's controlling movement over borders and the rights to autonomy in public and domestic spaces. At Birmingham City University, we're currently in dispute on COVID safety. We've got a live ballot and we're just coming to the end of a couple of weeks of negotiation. Last summer, our university leadership pledged to students to have 50% of teaching face-to-face this academic year on campus. There was no consultation about this decision. Rather, it was an impulsive act designed to carve out a place in the turf war that was going on at that time over students under marketisation. Birmingham City University is a working class university, and after other universities dropped their entry gates, bosses acted in fear to try to keep a place in the market. This has been continually driven by an argument around class. It's an argument that our leadership use that draws on the conditions working class students live in. They talk about homes being unsuitable for work or study, but they never acknowledge that this is the result of a failure to reverse the assault on homes Thatcher carried out with Right to Buy, which successive Tory and Labour governments have failed to do anything about. They talk about homes being dangerous for students, but they fail to acknowledge the destruction of domestic violence services and early intervention and austerity, or the failure of the education sector and wider society to raise our children in an environment which ends male violence. They talk about digital poverty without ever acknowledging that working class access to education, whether virtual or actual, has been vandalised for decades. They talk about mental health needs, but they never acknowledge the fact that CAMS has been stripped, wider mental health services have gone, or the conditions currently causing huge amounts of anxiety for students about family members being forced into work in unsafe conditions, whether that's in the health service or whether it's in places that are being forced to continue because of the economy. Birmingham City University have not taken industrial action since the pension strikes of 2011, as we're locked out of national bargaining. We've beaten the anti-trade union threshold in a consultative and industrial ballot, and if we do not secure a commitment to COVID safety, not just for our members, but also our students who live in multi-generational households, use public transports, and are carers for those who are put most at risk by the negligence of current COVID strategy, then we will be serving notice. BCU calls itself the University for Birmingham, and it needs to act with responsibility towards our community. The decision to push education on site across our sectors has slaughtered working class people. We're doing everything we can to challenge the violence of our system by acting collectively to deliver the radical love that's needed to build something better. Please support us in solidarity. Thank you.
Thank you, Rhiannon. Solidarity, and I believe we are going to put up an email address that you can send messages of support to this branch, and also on the UCU website you will find other branches that are taking action on this to send support to as well. But please give them some love and support. Thank you, Rhiannon.
Thank you.
I'm moving on to the next speaker, who is Helen O'Connor from the People's Assembly. Helen is also a GMB trade union organiser, the NHS sector. People's Assembly have incorporated zero COVID strategy into their campaigning work, and you're very, very welcome, Helen.
Thank you so much for inviting me to speak, and I send you solidarity greetings from the People's Assembly and the GMB Trade Union. Comrades, I think it's correct to say that coronavirus is now endemic worldwide and likely to be a long-term problem for us all. The information in the public domain tells us there are new mutations of the virus circulating. I also think it's fair to say that the public desperately want to see the end of lockdowns because the repeated and protracted lockdowns are themselves having an adverse impact on people. There's no getting away from that. And we also know that some might even mischievously and falsely claim that the Zero COVID campaign is calling for lockdowns to be extended until COVID is completely gone. This is not true. Far from pushing for never-ending lockdowns, the focus of the Zero COVID campaign is to advocate a safe exit from lockdown, an exit that protects lives and livelihoods by making funds available to support people properly and by implementing the strongest health and safety measures that support maximum suppression of COVID-19. And it's important to remind ourselves from the outset that Tory government COVID-19 strategy has led to the perpetual and lengthy lockdowns that have been, and there's been so many unnecessary deaths. And so far, government policy has not been guided by the science. Dangerous and false arguments have been made that there's some sort of choice to be made between public health and the economy. The scientific modelling is telling us that infection rates are likely to rise again and that further deaths could result. And we are also deeply concerned about the staggering rise in unemployment. In 2020 alone, there was a 95% increase in people claiming universal credit because this Tory government has failed to protect jobs and livelihoods. And in the meantime, we've seen billions of pounds of public money being thrown into systems that are failing us. And ruthless employers have been getting away scot-free with undermining lockdown and failing to implement health and safety measures. And this is a direct result of the failure to hold these employers to account because the health and safety executive has been defunded for years. Another key feature of the pandemic is this government have prioritised the interests of big business, and quite literally their friends are looting the public purse and they're awarding contracts that are failing to deliver, and we're witnessing open corruption on a massive scale, and cuts in privatisation are being accelerated. People are morally outraged by the 1% pay cut being imposed on the nurses. The nurses are the people who've delivered for this country during the pandemic when private companies have not. And I'm proud to say that my union GMB is backing the grassroots call for a 15% pay rise for all NHS workers. And let's be clear what the 1% is. It's part of a deliberate strategy that's been going on in the NHS and public services for years. The formula is demoralise staff, cut pay and conditions, defund services, claim they're not fit for purpose, and then privatise them. And we should also be very concerned about the erosion of civil rights and the rights to protest. We support restrictions on suppressing the virus. However, we cannot support attempts to suppress genuine, risk-assessed, safe, socially distant protests. And refusing the right to hold a vigil for Sarah Everard is, in my opinion, a very good example of how these new COVID-19 powers are being misused and abused. In the absence of a safe exit from lockdown and the confusion around the question of protecting lives and livelihoods, we need the widest possible alliances to be built across the labour and the trade union movement. We must unite to demand the strongest possible health and safety protections, full economic support for all working people, including unemployed and disabled people too. End all cuts and privatisation. Privatisation has failed the nation during COVID-19, and our movement must present a genuine alternative to a system that cannot provide economic stability for people and that cannot protect lives. Thank you very much.
Thank you so much, Helen. Helen unfortunately has to leave us, but we'd like you to bring solidarity back to the nurses and indeed all the health workers who should be getting a pay rise and have already paid for this crisis with their own health and well-being. So solidarity.
Thank you so much, comrades.
We have last speaker, Louise Regan, and perhaps just before Louise speaks, it's the time for me to just say, in terms of protest, our solidarity. Obviously, I'm a woman. I would have intended to be on the vigil tonight. We were having one where I live, and the Kent police have said they will fine every one of us if we turn up. We do not think it is appropriate or right to prevent women from maintaining a vigil for a woman who was murdered by a policeman, quite stunning, who'd been let off by other policemen in the days before her kidnapping and murder from charges of other sexual offences. It's just outrageous that protest, even the form of a vigil, which is safe, which is outside, which is masked, which was protesting at the risk that we have every day that sometimes feels bigger for us than the risk of COVID, to be honest, when we're on those streets. It's an outrage that they banned this protest, and we must have the right to protest safely. So that message from us to everyone who is taking online and various actions tonight in terms of women's safety against sexual harassment and violence. So our very last speaker before we come to you all is Louise Regan from the NEU, who have fought a long and hard battle to keep our schools safe. Louise, over to you and welcome. Glad to have you.
Thanks, Elaine. And just on the point you raised about vigils, we are still holding our vigil today in Nottingham unless we get stopped, but we're hoping to go ahead with that later. But our National Executive issued a statement yesterday, signed by lots of members of the executive, supporting women in their right to protest safely and urging our members to attend vigils where they were taking place. We think it's an absolute disgrace that people are being stopped for speaking out against this, and the very people who are supposed to be keeping us safe are the people that are attacking and killing us at times. But so thank you for inviting me, and solidarity first of all with all the people that have already spoken. A very powerful event, and all of you who are taking action and in struggle, we stand with you, and I send solidarity from the National Education Union to you, but also all the people that have given so much information about the work that they are doing to continue raising awareness about the situation. As you say, my union's been at the heart, really, of fighting against the government from the start of this pandemic. Right back at the very start last year, we had to put huge pressure on the government, who wanted to keep our schools open despite all the evidence that cases were rising out of control. And we did then force a closure of schools. I will say, and I say this everywhere I speak, schools and colleges have never been closed. They have always remained open for those children and young people of key workers and vulnerable children, and or children that need additional support. We don't like the term vulnerable in my union, and I'll talk about that when I talk about our members. We set out a plan for the wider reopening in September, which was completely ignored by the government. I have to say the government has not engaged with us or listened to our advice at any point, and actually had they engaged with education unions, I think we would be in a much better position. We've provided clear advice and guidance to our members throughout this pandemic, and we have had a significant increase in membership. But not only have we had an increase in membership, we've had an increase in active members, so people taking on role of the health and safety reps and workplace reps, and we know that by having those people in place, we can keep our workplaces safer. And we've stood up for members at higher risk. We've done a huge amount of work, online meetings and events to support them, give them advice, and engage with other members so that they're supporting them as well. And where necessary, taking or threatening to take action if members are being forced into safe settings. In January this year, we held an online meeting with over 100,000 members as the government prepared to reopen our schools on the 4th of January. And on the Saturday that our meeting took place, the government told the public that schools were safe. There was nothing for people to worry about. By the Monday, after our members had issued Section 44 letters in their thousands up and down the country, the Prime Minister came on television to tell us that our schools were a vector of transmission. I don't know where it goes, how something can change so rapidly, but I think our action definitely forced the government to close the schools. I think what I would say, we're now back in a position where schools are open more widely. We have provided advice and guidance to members again. Cases are low, but we have had an incompetent government that has not handled this crisis. We have lurched from one lockdown to another, and the government has not learnt from any of it. It has not thought or had a clear strategy, and it's been too busy sort of giving money to companies who are not doing things well. And we have been really anxious about that. I'm particularly anxious about that. We want children and young people in schools and colleges, but we want it to be safe. And we know that when cases are rising, we need to reduce those numbers to protect our NHS, to protect the NHS workers as they're struggling to look after people. So we know that children and young people don't get ill massively, but we do know that our schools can be vectors of transmission, and we have to protect our communities. Had we planned and prepared well, we could have reduced rates, we could have protected our communities more, and we think that had the government listened to the union, we'd be in a much better position. Thank you.
We would indeed, a much better position. Thank you so much. Before we go to the open discussion, I'm going to give 5 minutes to Olga and to Jacqueline. We are very, very pleased to have a member of the IWGB, I never get this right when saying it, but I have been on many events that these workers have organised, and they are a fantastic campaigning union. So please welcome Olga, and Jacqueline will translate.
Buenas tardes.
Hi, good afternoon. Thank you very much.
Mi nombre es Olga Sierra, oficial de mujeres y no binarios de la rama Cleaner and Facilities.
Espérame, Olga. Good afternoon. My name is Olga Sierra, the Women and Non-Binary Official of the Cleaners and Facilities branch of the IWGB.
Nuestra rama ha afrontado desde el inicio de la pandemia un gran reto al buscar alternativas de apoyo a todos nuestros miembros.
First of all, espérame, Olga, voy a dar las gracias a la organización, ¿vale? Sorry. First of all, thank you very much to Zero COVID UK organization for having invited us to this online rally that is so important to make visible the safety and health needs of the population in this time of global pandemic. In our branch, we have faced a great challenge since the beginning of the pandemic and had to look for alternatives to support all of our members. Continúa, Olga.
Recibimos a diario un sinnúmero de llamadas de empleados que han sido despedidos sin justificación y se ha notado el abuso de las empresas de limpieza apoyadas por el gobierno.
Every day we received countless calls from employees who have been dismissed without justification, and the abuse of cleaning companies supported by the government has been noticed.
Por lo que decidimos iniciar campañas como la de Fight for Love Now, en la que exigimos un furlough justo e indefinido hasta que se pueda retomar nuestras vidas en el entorno laboral.
So we decided to start campaigns like Fair Furlough Now, in which we demand a fair and indefinite furlough until we can resume our lives in the work environment.
Durante esta campaña hemos sido apoyados por más de 30 parlamentarios y algunas instituciones no gubernamentales. logrando así una extensión del furlough hasta septiembre del 2021.
During this campaign, we have been supported by more than 30 parliamentarians and some non-government organizations, thus achieving an extension of the furlough scheme until September 2021.
Sin embargo, necesitamos que nuestros trabajos se conserven de una manera indefinida. Pensamos que esta extensión solo prolonga un poco nuestra agonía en cuanto a la incertidumbre que estamos viviendo.
However, we need our jobs to be preserved indefinitely. We think that this extension only prolongs a little the agony in terms of the uncertainty that we are living.
Como rama y con la colaboración del Sindicato Central, seguiremos adelante y presionando con la colaboración de los medios de comunicación y toda la gente que se quiera unir a nuestra campaña.
As a branch and with the help of the Central Union, we will continue to press forward with the collaboration of the media and all the people who want to unite and join our campaign.
Nos pueden ayudar difundiendo en todas sus redes sociales, así como familiares y amigos. Y creemos que con unidad y colaboración de todos ustedes, podemos que nuestras voces sean escuchadas. Gracias y por su invitación.
That is why we ask you to join our campaign and help us spread the word on all our on all your social media networks, as well as with family and friends. We firmly believe that with the unity of all of you and collaboration, we will be able to make our voices heard. Please sign our petition and follow us on social media to see the progress of our campaign and our work. We'll leave all the links here with you, and thank you very much for inviting us, and we support all of your work as well.
Thank you very much, and solidarity in the fight to get people on furlough with no detriment and full support. It's a key issue for us that this should happen for everybody who needs to be off work.